California's Governor Newsom rolling back reopening efforts after a spike in confirmed cases of COVID-19 in that state. Here to discuss that now and its effect on our hospitals is Los Angeles ER doctor Jennifer Ellice. Doctor, thanks so much for being with us. You're on the front lines there in LA. Was this just a matter of time for you? Did you expect the governor to roll back the reopenings?
Thanks, Alexis. Yes, absolutely, we did. I think just to illustrate what we're seeing, in March, when this all became very critical for everyone and we had the first shutdown, we had 2 pods running of COVID patients, one for acute COVID patients and one for less sick COVID patients. And when we got to early June, we had trickled down to 1 pod and very few patients were coming through that. Just yesterday, we are opening now our 4th pod just for COVID patients in my emergency room. So this most recent surge has been very dramatic, and we've begun seeing a lot more patients.
Doctor, when you talk to these patients, what are they telling you? How do you think have they been out and about? Why do you think that this surge is in fact happening?
Well, a lot of patients I'm seeing are essential workers, so they haven't really had a choice but to go back to work when we reopened. And they've been forced to work in situations where they haven't been completely protected. They bring it home, and in many cases, they live with their entire family, several generations in one house. And I've seen mothers bringing in their 7 weeks old. I've seen grandparents whose children beg them not to go out, and the entire family is now infected. So it's been a bit surprising to see a lot more young people who have been suffering this time around. I think the first go around, we saw mostly very vulnerable populations initially, but now we're sort of seeing a boom, and we're seeing the disease take people from all walks of life and all ages.
What about the severity of the cases that are coming in, doctor? Are more people actually needing to be hospitalized? What about the use of ventilators this time around?
Well, fortunately, here in California, I think in some part due to our first shutdown that was so aggressive, we have had a flattening of the curve. So we haven't had some of the challenges that places I'm seeing my colleagues are having in Texas and in Florida, and similar to what happened in New York and Wuhan. So we've been able to handle the surge that we've had so far. Another surprising and fortunate thing is that we've been able to manage a lot more of this disease better. So with new treatments, with things like permissive hypoxia, where we allow patients to become, for their oxygen level to go very, very low before we intubate them, with proning, with treatments like remdesivir, interleukin inhibitors, we've been able to save a lot of patients and prevent them from dying. I think that these patients, if they had arrived in the first wave, may not have been so lucky. So in that respect, it's been surprising. But I have to say, and I know a lot of my colleagues have been saying, death is a lagging indicator. So even though we're seeing healthy young people now getting infected, if their colleagues and their friends and their family are older or more vulnerable, we may see the deaths coming in the next 2 or 3 weeks.
Doctor, you saw the school districts of Los Angeles and San Diego announce that schools will now be going remote in the fall. Do you think that was the right call?
I'm not a pediatrician, so this would just be my opinion. But we have to think about a lot more people than just the children. And, it has been oft-cited that the children are less affected in general than adults, but teachers, the families of the children when they go home, it seems to me to be the wisest decision. And I, had grave misgivings about sending my child back to school because it's just, if we had the pandemic under better control, if we had used the first shutdown to get effective contact tracing to protect vulnerable populations, if we had used it to decrease the number of infections, then I think maybe I would have felt a little bit more comfortable about it. But in this current environment, I think it's absolutely the right thing to do.
And tell me how this is different than from what you're explaining, this seems to be a new peak, even surpassing what you saw in March, if I'm hearing that correctly. And this time around, do you have the protective equipment that you all need to do your job effectively?
Well, I wouldn't say it's a new peak yet, although if the trends continue, it will very much be a new peak. And I can say that from hearing on doctors groups and social media from my colleagues in Texas, in Arizona, in Florida, they are definitely starting to face some of the horrors that my colleagues in New York faced. As far as California, we haven't hit that measure yet. But when we do, and if we do, I fear that we may not have the PPE, because I'm already hearing from some people that both in my hospital system and outside that it's once again becoming a little bit tight. So this is something that keeps me up at night. The other issue is staffing. A lot of people who are on the front lines in healthcare have become ill and will continue to become ill as this surge continues. And so staffing becomes very critical. ICU staffing, especially emergency room staffing, is very highly skilled people. And as they become ill, and if we don't have enough PPE, more of us will become ill, then that's going to be another bottleneck.
All right, Dr. Ellice, thanks for your time this morning, and our best to you and your colleagues.
Thank you. Appreciate it.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.